I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. And I'm your host, Dr. Tara Harding, and today we're continuing along understanding sperm and fertility and having a conversation about why this is so important when you are navigating fertility treatments. And it's not just brushed off or dismissed if you have values that are not optimal and in the good zone. If there's any little number is off, we need to be optimizing your health and talking to you about that as a couple and as an individual. So we know that fertility treatments are so complex and it requires some issues, including poor count, poor mobility, morphology. These are common causes, and yet they're overlooked all the time, every week in my practice. If you're lucky, if you were even checked, that's happened too so much lately where the male has not even been checked, and there he is. No sperm, low sperm going on. We just have to take this more seriously and start checking men right away. So let's look at the roles. Sperm are the male reproductive cells. They are what carry the genetic information. And for conception to occur, your sperm has to be healthy and then it has to implant with the woman's egg. So factors like count, motility, which is the movement, morphology, which is the shape, significantly influence male fertility. Even the slightest abnormality will impact conception and leave you at risk from miscarriage. Again, we're going to have another guest episode talking about sperm health, specifically even with IUI treatments. And when there's sperm issues, that increases the chance of miscarriage. So let's dive in and talk more about why it's crucial to diagnose specific sperm-related problems. Common ones are low sperm count, poor sperm motility, abnormal sperm shape, and then no sperm at all. Like when there's no sperm being ejaculated, huge issue, see it all the time. I'm going to link my favorite home sperm testing device called Yo in today's show notes. I use it all the time in my practice, and men and couples are so happy when they know they can do this at home. I even got you guys a discount code. So check it out today's show notes. We really have to take this serious and diagnose these issues and address them sooner. So fertility treatments are really multifactorial and depend on how severe it is, what's the cause of it. So let's take a look. Number one, I think both men and women need to be working on lifestyle changes and modifications. We need to look at your sleep, your cortisol, aka your stress, your nutrition. Are you doing alcohol, nicotine, vaping, drugs? Things like that, toxin exposure, what's your work environment like, and really work on that. Nicotine. I said it last week. It's significantly, I've seen this in my practice. I could do like a study on this. The role that just nicotine alone has on sperm is significant. And that includes those little pouches that start with a Z that the men are doing. I don't even know the name of them. Stop them. Stop. We have to improve your sperm, and that means eliminating nicotine, okay? Supplements, we have a whole list of basic supplements that we usually bring in and modifications to your lifestyle that can really make this easier to navigate through. And so you as a couple can be doing these things together and working to optimize your fertility together. There's, of course, assisted reproductive technologies part, and that's things like IUI, where we take the sperm, we wash it and clean it, and then directly put it into the uterus at the time of ovulation. And this is often used a lot too if there's even minor issues going on with sperm. Again, I see them overlooked. They're like, carry on, let's just do an IUI. And in my practice, we're working on improving that before we're even doing an IUI. You don't get to just walk into an IUI with sperm issues. We're going to optimize that. Of course, there's in vitro fertilization or IVF, and that's very involved where the egg is fertilized by the sperm outside the body. You can do FNP-C, where they take a single sperm, one sperm, and put that directly into the egg. And so there's a lot that goes into that if it's on the male or if it's both male and female factors going into that. And then sometimes there's some surgical procedures that can be done where there's blockages or variceles and large veins.
that can be corrected with surgery. And that surgery can improve fertility in itself too. So we have to be looking at all the things. Vasectomies, I see a lot in my practice to reversal. We're doing things to optimize and really look at that. Like levels maybe were good and then they dropped for some reason. So we have to look at so many different factors that go into that too. And then again, I want to just touch on the emotional aspect and impact that this has. Infertility is hard. It's really hard. I just want to validate that. And it's a lot to go through this process too. And I just want to talk about open communication with you two as a couple. Always keep that open. Understand each one of you is going to go through this differently and surround yourself with education, with support. Say no to things, put barriers up when you're going through this stuff right now. Perhaps bring in counseling, individual, couples, support groups. Find others who've been through it that you are comfortable talking to and don't do this alone. It's very hard, it's very isolating. And so navigating what to do. Maybe this person did this and this person's doing this and this person's doing that. Bring in a provider such as myself who can help be your co-pilot and navigate these things with you and help you better understand all of your options and the unique journey that you two are going through as a couple. There's no cookie cutter way to do this. And it's going to change and look different, maybe depending what you're going through, your beliefs, your where you live, things like that too. So having a team approach to this is super important on your path moving forward. Thank you for listening to this week's episode. I'll see you back here next week.